So thank you so much for joining us on this first day back from April vacation. I appreciate you making the time on this sunny afternoon to join us. We have people kind of trickling in here. Greeting people at the door. It's incredible how much research is coming out right now based on that. Jess Anderson and I have had the opportunity to work together with some tier 1 practices, and that's one of the that's the piece that keeps coming back over and over and over again. Seems like such a simple thing to do, but what a profound impact it has. Right?
You know, what I like about, sorry, I can't help myself. What I like about greeting people at the door is that's something that can be done, implemented, not just at school for improving attendance, but in meetings, or if you're part of a community group that, you know, have somebody that is welcoming people and just makes people feel good.
I love that, Emily. It's interesting. I've been speaking with Denise Delory, and she talks about how you can carry that over to the medical model as well, just like you're saying, but always having somebody to greet you, welcoming you as you come in. Kind of sets the stage for what we're doing. I'm going to give it just about 1 more minute as people continue to trickle in, but if you think of anything else you'd like to share with others, something that maybe you have learned from the webinar series that you've had the chance to employ, or maybe just a tried and true practice that you love. Okay, well, let's get going. Julie, if you would like to keep an eye on the waiting room, and if you see anyone there and you'd like to,
I think you need to make me host, though. I don't think I am I? Co-host?
Let's see.
And then I will absolutely do that.
Okay. Let me just get to you real quickly. There you go. All right. Oh, the check-in in the morning and the finish greeting, finish getting ready if needed. That's true. That seems to work super, super well. Well, one last time, I'd like to thank everyone for joining us today. Then let's get started. I just want to kind of go back and talk really quickly about the overarching premise of this work that we have today. It's to provide subject area content, resources, and strategies to help school staff understand how attendance can impact a variety of health factors for school communities as it relates to health services, school climate, family engagement, and community involvement. To further empower schools and educators, the Maine Department of Education launched a 4-part series to deeply explore portions of the Maine Department of Education Attendance Toolkit. This series, it guides participants as we delve into specific sections of the toolkit, examining resources and strategies designed to increase student attendance. Each session has featured a content expert, offering a unique opportunity for schools to ask questions and develop actionable plans for implementation. Each of our webinars was recorded for future access on the up and coming Maine Department of Education, Maine Engagement and Attendance Center website. In January, we learned a little bit about the toolkit and explored the basics of it. In February, we learned about school climate and student supports. In March, we came together to investigate comprehensive health education and employee wellness. And today, we will be exploring health services and give you a few moments to reflect on the Toolkit webinar series and start developing your own action plan. This series was designed to provide targeted guidance for schools, ensuring the tools and strategies were integrated effectively into systems to address those attendance challenges that we're all facing. I would like to introduce myself. I am Sarah Nelson. In August of 2023, I joined the Office of School and Student Supports as a social emotional learning consultant, and then I stepped into my current role as student engagement specialist last April. Here, I work with our climate, culture, and resilience team to arrange professional development interactions with school personnel and community representatives statewide. I assist schools with implementation of student engagement practices, and I'm part of implementing Department of Education initiatives supporting the whole student. I've met many of you through our work with the regulated classroom and BAR, building assets and reducing risks. I assist with integration of evidence-based engagement practices that align with Maine state and strategic district plans. I'm very excited to announce up and coming, Jess Anderson and I have been working on a one-page, actually it's a two-page front and back, but a one-page tier one, a collection of evidence-based tier one practices that I think will be super helpful for folks. And most recently, as I said, I've been really looking at the spotlight of increasing attendance through collaborative practices with a Maine Engagement and Attendance Center. So that's me in a nutshell. And I would like to now introduce our content expert, Emily Poland. Emily is a registered nurse and nationally certified school nurse. She is the school nurse consultant and team member in the coordinated school health team as part of the Office of School and Student Supports within the Maine Department of Education, serving as Maine DOE's resource expert for the development and implementation of policies and school health programs that promote and maintain the well-being of students. Oh, what a mouthful, huh? She is definitely a lady that is full of information and resources. She has been influential in her involvement in research, impacting the delivery of quality healthcare services in schools, and her involvement in the development and passage of important legislation, policies, standards, or regulations relevant to school nursing. She is active at the national level within the National Association of State School Nurse Consultants, as past president, technology chair, and currently as their treasurer. Emily finds work of school health very rewarding because, as we all know, healthy children are better learners. Everything we do is to improve outcomes for students. When not working, Emily enjoys time with her family, knitting, reading, gardening, and spending time outside in our beautiful state. Hopefully today, Emily, you had a chance to spend some time, get a little bit of sunshine. And with that, I'd like to turn our program over to Emily, and she is going to be presenting the health services page of our attendance toolkit today.
All right, let me get started here. Are you looking at the right thing?
It looks beautiful. And I would like to remind people that following our time together today, I will be pulling together a quick email that I will send out to everyone. It will have a recording of today's session as well as links to the slides that Emily is presenting. So if you want to just kind of kick back, really drink in what she's saying, you don't need to worry about anything. You will be receiving it shortly. So thank you, Emily. Take it away.
And tell me how many minutes I've got again.
We are looking at about until 4:10ish. So let's see, it's 3:39 right now, about 15ish minutes.
Okay. All right. So as Sarah explained who I am really glad to be here. And she also said, this time goes by really, really fast. So I will try not to talk too fast because I tend to do that, but bear with me as I try to give you an understanding of what I thought to be most important for thinking about health services as it relates to attendance. And you can see the kind of couple learning objectives here. And I'm going to start off today with a little bit of a history lesson. And for those of you who might not know, school nursing and efforts to reduce chronic student absenteeism has a very long history in the United States. It actually began in the early 1900s. The specialty of school nursing began in New York City in 1902 with a nurse named Lena Rogers. And as an experiment, in response to school chronic truancy problems, the school doctors, the school physicians, were sending students home with various orders for illnesses and infectious diseases, and the parents could not read the prescriptions. The parents couldn't get the prescriptions filled, or they might not even understand the directions, and the students couldn't understand the directions. So instead of seeking out help, maybe they just didn't even go to school. But when the school nurse, Lena Rogers, got involved, schools enjoyed a 50% decrease in absenteeism through health promotion and illness prevention activities. Lena Rogers was able to successfully show the correlation between the reduction of school absenteeism and healthy children. And the goal of school nursing is the same today, to promote health in school children so they can attend school and be in the classroom and ready to learn. So we know that health influences school attendance. There are times that the nurse is the one saying, you need to stay home from school, right, because you're sick. But we want to be able to decrease unnecessary absences. So just to think about some data around health issues in school, there isn't really one source of data for children with chronic health conditions. The CDC estimates about 40% of children have a chronic condition, such as asthma, diabetes, seizure disorder, learning or behavioral disability. And as an example of how chronic conditions impact attendance, data from the American Academy of Pediatrics showed that 13.8 million students missed school days per year because of their asthma. 51 million school hours are missed each year due to dental problems. I can tell you that the most common preventable disease in children is dental caries. Just a piece of trivia, maybe, if you're going to be on Jeopardy. 14% of school-age children take medication regularly. And what I want to note here is that it's important that children with chronic health conditions, that we're not saying that children with chronic health conditions, they do tend to miss more school, and that high absenteeism is an indicator for poor academic achievement. But we need to be careful to remember that having a chronic condition does not cause poor academic achievement. Better health management within the school can reduce those negative academic outcomes. And the COVID-19 pandemic helped the world to learn that ensuring a healthy school environment is of utmost importance. So we need to balance that, protecting the school population where we can from infectious disease and the like, and keeping kids in school as much as possible. So one of the things most associated that people most associate with school nurses or school health services is immunization requirements. We know that immunizations remain the single most effective way to protect against many diseases and even some cancers. Reviewing student-specific data and reporting to Maine CDC is a required thing of schools. They have to do it every year. And along with that, there's a lot of communication between the school officials and families. School officials frequently is that school nurse. So making sure that we are using accurate evidence-based information and recommendations is so important. School immunization reports, just so you're aware, that those are available publicly and can be accessed on the Maine CDC website, and that link is there for you. We also have misconceptions about the risk of communicable diseases that might lead to unnecessary absences. And I use the term communicable diseases a little bit loosely here because one of the most common communicable disease that leads to high absences is head lice. That is not considered a disease. It is a nuisance, but just making sure that we are using accurate information and school policies and education that reflects accurate information. Just as I referenced head lice, and head lice is like, when as a school nurse, I always hated to even hear the words, but it is a nuisance, and it takes a lot of work and support for families to deal with that, but it is not a reason to be missing school. So we really want schools to be able to develop a process to obtain and update the annual accurate health information for all students, and making sure that the school nurse has those resources and time that they need to meet with the students and parents to develop those individualized health plans. Because that relationship fosters better communication and allows the nurse to recognize emerging problems before they become a reason for the emergency room or end up as a hospitalization. The school nurse needs to be aware of all of these, some struggles that families have or conditions that students have, to be able to keep an eye out for those specific things. One strategy here that I'd like to just highlight is that we really should be requiring that the school nurse is part of that multidisciplinary team, the education planning teams, whether that's your 504 teams, your IEP planning teams. When you're creating education plans for students that have chronic conditions, that nurse needs to be at the table. So I'm going to just share a story about a nurse. Her name was Donna, and we do have permission to share her story. She was tasked with looking into a student that had missed 3 weeks of school. And I really think that those absences really could have been fewer if the nurse had known sooner. Because after a phone call and a meeting with the parent, the nurse learned that the student had juvenile arthritis, and they weren't able to afford their medication. They had difficulty being on time for the morning bus. If she missed the bus, she had no other transportation to school because her mom, her single mom, had to work, right? So Donna worked with the school to provide appropriate accommodations, helped the student and her mother obtain the necessary medical treatment and the medications that they need, and then created a plan for when the student missed the bus. So these efforts result in that student being back in the classroom. And just a little bit of information about juvenile idiopathic arthritis, just for your own curiosity, if you're wondering about juvenile arthritis. But having a policy for chronic condition management can improve the implementation of the health plans. So the link that is shared above is a sample from the National Association of School Nurses that incorporates the policy for chronic condition management right into a wellness policy. And wellness policies, as you learned in March, I think it was March, those are required for all school districts in Maine that take part in the food and nutrition program.
Emily, I love how you touched on really eliminating barriers, thinking about what the challenge is. That's key. Thank you.
You're welcome. Another thing that we can do in schools is to develop educational campaigns to address seasonal topics. So that might be in the cold or flu season. It might be Mental Health Awareness Month, or Suicide Prevention Month, or Oral Health Month. Use those times, capitalize on them, and send out messaging to your families about prevention, and as well as things to look for, or maybe some resources that you have in the family in your area. Forgot to clean up my notes on this screen here. I wanted to share something that we have within the school health pages, and that is your school health office welcomes you. This is like a one-page document. I think it is actually just one page. Like, I know we use one pagers very loosely, and it's one in back and front, but I believe that it is only one page, but maybe not. But this document is translated into like 9 languages, I believe. So, and it's very basic. It's like, what does the school nurse do and why you might go see the school nurse. it can be really helpful for schools to use. As an example of a policy, there's some school nurses in a rural district participated in a whole district-wide program, and they looked at attendance policies. And so they reviewed all the policies, they updated them, changed them, and started actually enforcing their policies. The school nurses started tracking health office visits using their data system, and then followed up with children who were absent for health reasons. And through these combined efforts, they saw an increase in their attendance, a decrease of daily absenteeism, but also just an increase in overall attendance. Especially for that school, the number of students with a known health condition and 6 or more absences, that was a population that they were trying to look at in that school, like those with chronic health conditions and were chronically absent. What can we do to remove those, whatever is happening at home or with the chronic health condition, to remove that barrier or problem and get them back in school? So we can increase the supports that the student has at school in order to reduce the number of absences due to their diabetes, due to their asthma. I hope that made sense. So school nurses are part of that multidisciplinary team. They build positive connections with students and families. They support engagement with the community resources, and they really help to improve school attendance. School nurses can provide the necessary health interventions in order to remove barriers to learning that may exist due to their chronic health conditions. And again, here I've tried to include some resources that you'd be able to access. The Healthy Schools graphic, which is just a snapshot shown here. There are lots of different graphics that a school could use. You can download it as an image file and you can put it on your website. You can put it in your newsletters. You can send it through social media. There are messaging that already exists that we don't have to recreate. You don't have to create this stuff on your own. It already exists. Let's use the resources that are out there. And then, of course, Attendance Works has a lot of resources as well, and that actually researched access to some research articles that shows that connection in between health and attendance. And with that, I am all done at 14 minutes.
Perfect. Well, I have to tell you, Emily, you could not have set the stage more perfectly for us, because we're just about to step into breakout groups. And in our breakout groups, I am going to be asking people to really think about what are the steps that your school teams or attendance teams have taken to include health services in the planning for increased attendance. And sometimes this is you spoke about this a couple different times, the importance of making sure that you have your school nurse as an active member of that team, really looking at the barriers, thinking about how you can access those resources. So I'm going to place in the chat right now a question for you to ponder as you go into your breakout groups. Again, what steps have your school or attendance teams taken to include health services in planning for increased attendance? And how has this impacted your attendance? I'm going to open up breakout rooms. We are going to have 4 different rooms. I am going to open them all right now. And you may choose a room I'm just going to let you choose where you'd like to join. When you come back, I am going to ask you to share your thoughts. Summarize one step that your team thought they could take to see the connection between health services and attendance. So we'll come back together at, let's say, 4:10-ish. How about that? 4:10. I'll see you back in the main room. Does that work?
It doesn't seem to be giving us the option to choose.
I
can just do 4 random rooms,
Yeah.
Sarah.
Okay, Yeah,
Let's
I'm not
see,
sure what oh, you know what? I didn't push assign. Maybe that's what I needed to do. Yeah.
maybe,
Yeah. Do
let's
you want me to do
see,
that?
recreate, include cohorts, assign manually, 4 breakout rooms. There we go.
Thank you.
See if that works. Nope. Interesting.
Oh,
Inter-
I've got this. I know what I'm doing. How about this?
Okay,
I just clicked allow participants to choose room. Hopefully that
Yep,
lets
it showed
that
up.
happen.
It showed up.
Yay. Okay, I'll see you back at 4:10, guys.
I'm sorry, I'm not sure how to find a room.
Okay.
I don't see it either.
You don't see it. Okay. When you go down to the bottom bar, there's a place that says breakout rooms. It's 4 white cubes. If you click on that, it should give you an option to join, and you can either join room 1, 2, 3, or 4. You click the blue join button. Okay, as you're coming back in, I'm going to invite you to just drop in our chat. Maybe summarize one step that teams can take to see the connection between health services and attendance. Again, I will take all this information from our chat and I'll include that in our email so that you can reflect back on some of the practices other people are doing across the state. All right, guys, thank you for coming back and joining us. As you're coming back in, I'm going to invite you to summarize one step teams can take to see the connection between health services and attendance. Just drop that in our chat. As I was stating, this will also be included in the email that I send out to you, so that you'll be able to reference that. Okay, suggesting that nurses join the attendance team at least once per month. That would be great. That would be a great start. Tracking data to find out the sources of absenteeism more clearly. Again, my friend Jess Anderson, data, or data. She's a data girl or a data girl, I'm not sure which, but definitely looking at that so that you can really see. You can't make the changes if you don't know what the, oh, actually, Allie would be the data girl, right? But definitely looking at it. Okay. Well, as you are a new, let's see, our school nurse attends community connect meetings where we discuss our high-risk students. Great opportunity to just get that additional perspective. Thank you. Thank you. Up-to-date research for protocols for keeping kids out of school. And can you point us to the evidence-based research? All right, so Emily, do you want to speak to that really quickly? This actually is a perfect segue as we have the opportunity to ask any additional questions we might have for Emily right now. We'll take about 10-ish minutes. If you have anything that you'd really like to. Emily, do you have a thought on that one?
Yeah. Okay. I didn't know if you were done. So, are you talking about, I just want to clarify. So Amy, you're asking for when kids should stay home from school. One of the, if that's what you're talking about, the attendance, when is too sick for school, which is from Attendance Works. And I think I linked to it in my PowerPoint, but it is available on our website. It's available on the Attendance Works website. It's probably available on Count Me In's website, but I'm going to put the link right in the chat. That is based on that's evidence-based. It's evidence-based guidance for when you should stay home from school. So that's a starting place, but was there something else that you were looking for?
Do you know when that's dated, Emily?
I believe it was created last year.
Okay, thank you.
That was my understanding. And Emily, it is one of the resources that are provided in the attendance toolkit. It is the fourth resource. When is too sick for school? And it's an infographic for determining when students should be going to school or staying home.
When someone contacts us and asks about, that a nurse has contacted us about, let's say strep throat, like this family has this student has strep throat, how long are they supposed to be out of school? There are a couple things that we would reference. One is a communicable disease quick, I'm looking at it to see the title of it, Communicable Diseases Quick Guide for the School Nurse and Childcare Settings. That was created by Maine DOE and the Maine CDC. So that can be like you can look at, it's a chart, you can look at strep throat and see the recommended time you should stay out. Another resource that we frequently will go to is the Academy of Pediatrics. The American Academy of Pediatrics has a book that is about managing infectious diseases in schools and childcare settings. And that is a tried and true resource that we use as well.
Thank you. We were in our group, we were just discussing about how sometimes childcare centers use school protocols, and some of those school protocols aren't up to date. Like, for instance, you threw up within 24 hours, you still don't have a fever, you might have thrown up for some reason, but you can't come to school.
Right, and that's
exactly
not a reason to stay home, right? I choked on something and it made me throw up.
Right, exactly. Or I was anxious about something. So thank you for that chart. We'll share that out.
Great question, Amy. I do know that that's the whole post-COVID tenuous, like I'm not really sure what I'm supposed to do is still, even this many years later, it's still a sticky wicket that we're all trying to navigate. I'm not sure. I come up with these crazy expressions halfway correct. All right, Julie.
I love when you come up with those crazy expressions, but you sing them. But anyways, that's another conversation. Emily, the Too Sick for School document, is that one that your team had translated in other languages? Because I would think that would be extremely helpful.
I do not believe so, unless there's someone else from our team. But you're right.
Let's do it.
Look, it looks like it
Nicole,
is. When I just opened it up, it does look like it is translated in some languages. That was shared by Jess Anderson on the Too Sick for School.
There are more resources on the attendance work site than the Too Sick for School, and most of them are translated at least into Spanish and some are into others. So that's the link that I put in the chat for you.
Thank you for sharing that. Any other thoughts or questions you might have for Emily? Well, Miss Emily, thank you so much for joining us today. I do appreciate that. I know that you have another obligation that you're dashing off to. So thank you for your time. If we have any questions, I'll send them to you. But again, I will tell people we are going to be sharing her slides. You can access all of the links if you have any questions. She is going to be one of our next steps. If you need information, I'll have her contact information in the notice that I'll be sending out. So thank you, Emily.
Thank you.
We'll catch you later. Thank you.
All right, thank you.
So the next thing that I'd love to move on to is an opportunity for us to really just kind of take a moment. This is the fourth and final session of our Toolkit webinar series. And I would like to give people just a few minutes to reflect, thinking about 3 things that you learned, 2 things you found interesting, and 1 question you might have. I love it. It's called a 3-2-1 reflection. And I am dropping a template for you directly into the chat. If you click on this, you can make your own copy. I was thinking it might be helpful for people to just take a few minutes to just reflect, bring together your ideas, your thoughts. What were your questions? You are welcome to share this with me, or this is something that you could keep for yourself as you start thinking about what are the next steps in your journey of increasing attendance in your role. So with that, hopefully everyone's able to access that, make a copy of your own. We can take, how about, let's see, we're almost at 4:20-ish. How about if I kind of go radio silent and give people about 5-ish, 7 minutes. How about 7 minutes just to kind of get a few thoughts down? Then we'll come together for our last couple minutes and look at our next steps.
Sarah, do you want us to make our copy and then share it with you so you have it?
Amy, it's your choice. This is really a template for you. If you'd like to share it, I would always welcome it. But this is really an opportunity for you to reflect on what you've learned, things that if you have questions, definitely send them my way. If you're looking for additional resources, I'm happy to help connect you with that. But it's more for your reflective practices.
Thank you.
Sure. Let's come back together at 4:27. Okay, we'll give it another minute as people start kind of popping back in from their time reflecting. If you want to add anything to the chat, you're more than welcome to do so, whether it's something you have a question about or something you found interesting, any part of your reflection. I'd love to add that to our final reflection. And if you do have questions that you'd rather not put in the chat, you can email me directly and I'm happy to find the resources and get that information to you.
I love myself. As I was doing my reflection, Sarah, I was thinking about how I hope these amazing professionals share their ideas with each other in their buildings. However, I mean, we're so busy during the day of school. I wonder if maybe there could be a placekeeper in, say, a staff room. What ideas do you have to improve attendance, or what are the latest and greatest ideas, and maybe some of those helpful visuals that Emily. So almost like maybe we could create bulletin boards to go.
I do love the idea. I once, I know it sounds a little whack, but I'm going to share with you. I was at a bank, and in the bank, I needed to powder my nose. They had a bulletin board in the powder room where it highlighted just real quick snippets. And I was kind of a captive audience there, relaxing, powdering my nose. And I found that to be like, oh, hey, what a great idea. So I'm not saying that you need to establish a bulletin board in the powder room, but what a great place to have it, either in a teacher's lounge or something like that. Just kind of getting the ideas out. I agree, Amy. Oh, thinking about school improvement process and what schools can do to support their students and families. It's interesting, Amy. The more we get into this process, the more it sings true that it's really that analogy of what the three-legged stool, and you have the community, you have the student, you have the family, you have the school, and if one of the legs is not there, it just doesn't work. So keep going back to that stool analogy. All right. Well, we have about 2 minutes, and I wanted to finalize our time together by really thinking about next steps. In your follow-up email, you will have contact information for Emily Poland. She can help you with a myriad of health services resources. You could always go back to Susan Berry for comprehensive health education or employee wellness supports. You'll have information about reaching out to Courtney Angelisante for school climate supports. She's also a dynamic PBIS gal if you want to double dip there. We have Signe Lynch, who is an outstanding expert in McKinney-Vento supports. And of course, we have our Jess Anderson, who is just a powerhouse of information, working with Count Me In. I hope that you've had the opportunity to sign up for her newsletter. It has countless information, just short strategies, real quick, and I find that newsletter just kind of brings me back. The final thing that I would like to strongly encourage you to do is think ahead to August 5th and 6th. We'll be holding the Ed Summit. We have 3 attendance-based sessions that we're looking to hold. Julie, may I share these, or shall I wait? Right now, we have proposed supporting increased attendance and engagement through integration of the regulated classroom framework. And those of you that are familiar with the regulated classroom, we're really seeing an overlap through regulation, practices of regulation, and an increase of attendance. We have a second session talking about evidence-based practices promoting increased attendance. If you're looking for fresh and actionable strategies to strengthen your school's approach to attendance, that's a session you would want to attend. And finally, we have reaching and engaging all learners from the moment they walk through the door. How do we ensure every student feels seen, supported, and ready to engage in learning right from the moment they walk through the door? If you're curious and you're looking for ideas, that's the session for you to attend. Again, that's August 5th and 6th at Thomas College in Waterville this year. We hope that we're able to see you then. With that, I'm going to say thank you so much for your time. I appreciate you taking your sunny afternoon, and email me with any questions or thoughts you might have. Thank you, guys.